Now, so Dr. Karthik is here to have his take on artificial intelligence in cataract surgery. Over to you, Dr. Karthik.
Uh, yeah. Good morning, everyone. I first thank UC and AOS for giving me this opportunity. I'm going to talk about how the artificial intelligence is used in our cataract surgeries. First, what is artificial intelligence? It's nothing but a technology that enables computers and machines to simulate what humans can do, like human learning, comprehension, problem solving, decision making, creativity, and autonomy. Let's see how AI is used in cataract surgery, where it can be used in a preoperative stage, intraoperative stage, or in the postoperative stage. In preoperative stage, what can we do? Like initially, we'll do IOL power calculation. So, along with the normal formula, this deep learning formula, deep learning by using deep learning with established IOL formulas like SRK, Holiday 1, and LSF, we can improve the percentage of eyes within zero point 0.5 diopter of the predicted refractive outcomes. So, Ladas et al. Proved the same. So, deep learning using the artificial intelligence, the outcomes will be better after cataract surgery. And also, there is AI based formulas for calculating IOL powers also, like XG boost, Hill RBF, and Kane. These were used in highly myopic eyes, and they found that it is more accurate than the traditional Virgin's formulas and ranked much better than the formulas with Vancoach AL modification or newer generation of formulas like Barrett and Olsen. In 2021, Gonzalez and Bautista recently developed a deep learning model, that is Carmona. They named it as Carmona, which incorporates additional variables compared to other formulas such as curvature of the posterior corneal surface, etc. This Carmona model predicted IOL power was more accurate than the traditional formulas like Holiday or even emerging AI based formulas such as Hill RBF. So there are many formulas along with the traditional formulas. Some incorporates AI and some are purely based on this deep learning model. So it proved to be better than the routine formulas. And it is also used for diagnosing cataracts. How did they do? When there is while seeing the grading the cataract in slit they take a video, okay, and that video using this heat map, they are used to grade the nuclear cataract. First, whether diagnose whether the cataract is there or not, and after that, what is the grade of the cataract, and they compared with the human ophthalmologist, and both the AI and ophthalmologist had similar performance for diagnosing and grading the cataract. Another thing is using fundus photos. Another deep learning algorithm was used using the fundus camera. Tam et al. Used this. You can see the images here. Like due to the haze in the fundus, because of cataract, we get some haze while taking fundus photo. Based on that heat map, they are well able to diagnose the cataract, and this can be used in places where the trained ophthalmologists are not there. Just based on this fundus photo, it can detect and refer the patients to the ophthalmologist for cataract surgery. So, intraoperative stage, where do we stand now? Borisher et al. Tried a robot assisted simulated cataract surgery. See, here, do I have a pen? Yeah. Here, the person is sitting in this robotic surgery equipment, and he's not, and this operating room is little far away, just around 10 or 20 meters away from him. He's not directly operating, and he's using a dry lab simulator. This is a simulator. So here you can see he's operating in the simulator for phacoemulsification surgery. So what is the advantage of this robotic surgery is that they can go in all places. The wrist rotation, everything will be more, and 3D stereopsis, everything will be more compared to our routine surgery. But they have not. It is only in the simulated cataract surgery, not performed in human eyes yet. Another thing is based on AI. This is a microforceps. They have some sensors here. This Cutler et al. Made this model. They have some auditory force feedback substitution. Like when we hold this microforceps, and this is a simulated environment. It's not a surgery. It's simulated environment. Using this microforceps, they are peeling this paper, kind of thing. So depending upon the force which we give, this sensor absorb and say that you are giving more force or less force. It is giving auditory feedback. So based on this, we can evolve the capsular axis in the routine cataract surgery. Another is deep face surgical face recognition in cataract videos. Like they are taking the cataract video of surgery videos from the surgeons, and based on that, they are making a classification, like identifying the instrument and what step is being done. See, it is using this segmentation RGB image. Based on this, they are just creating a data set. When we create a data set, later on we can start using to guide us intraoperatively. We can guide whether the process is going on smoothly or is there any problem. It can be based on AI, we can say, but at present we are just trying to correct the data set. So the application of AI in surgical recognition and workflow analysis could be practically useful in progression towards a more efficient, smart operating data. So this is another thing like a phaco tracking. It is a computer vision based motion analysis tool. See this one, based on our motion, it is based on our movement, it is able to find out how they are performing. A preliminary study of phaco tracking found that junior surgeons exhibited a longer path length and greater variation in total path length and longer time of the procedure and greater number of movements compared to senior surgeons. So this analysis can provide a valuable data for training, say that how they are training and how they can improve. And this use integration of multimodal imaging. Here we can see intraoperative OCT. Here we can see the any defect in the posterior capsule, and depending on that we can do hydro or placing in the intraocular lens can be modified using the integration of the multimodal image data. Post-operative stage where it can be used, one is scheduling. It can schedule a post-operative appointment, and based on the AI can predict, based on the type of cataract surgery, type of cataract, and based on the surgeon, it can predict what complication can happen and when they need to follow up. So AI can predict the same for post-operative appointments, and it also can use to predict in which patient can develop posterior capsular opacification after phaco surgery. Also, AI can also predict that which patient can has higher risk for developing intraocular lens dislocation. Okay, even though there are AI has evolved so much, the main challenge we face is the lack of publicly available data sets. Only 2 data sets regarding cataract surgery data surgeries are available at present. Based on that, it is very difficult to create a smart theatre. Another limitation is that there is no standardization for deep learning metrics. It is yet evolving. So summary, AI can help in IO power calculation, grading or detecting cataract, facilitate smart operating theatre, enhance safety and efficiency, and contribute to surgical training. Post-operatively for surgical appointments and detecting complications. Despite significant recent advances, AI seems to be underutilized in diagnosis and management of cataracts. Thank you.
Thank you. That kind of pretty comprehensively covered what's happening in AI in the field for cataract surgery. I think as you've shown that AI is now coming equivalent to what the human is able to do, at least for diagnosis of cataract.
Yes, sir.
Of course, from a therapeutic standpoint, it still is early. But we've been using it now for quite some time in terms of the, when you're doing those tele-screenings and all. So there is, as of now, but it still isn't at that level, I think, of in terms of the agreement or accuracy. I was reading some papers, it was roughly in about 80 to 85% kind of values for the area under the curve also.
Anyway, clinical interpretation will be little different. So 80-90% is a good number for screening and sharing. For
From an
screening
AI
point of view,
standpoint, it is. Yeah.
And for the benefit of our neophytes here, as role of AI in cataract surgery extends beyond the surgery itself. And today, biometry is a very important aspect of cataract surgery, which Karthi will agree with me, where AI is already a part of biometry. So the formulas that we have, most of the formulas have AI incorporated, and that helps you in getting the right biometry for the right eye.
mm,
So AI helps you also in customizing the right IOL power, and that itself is a different topic, but I think that is another facet. As
yeah.
Digvijay sir told, very beautifully and extensively covered.
Okay.
Thank you,
Thank you.
Karthik.